Hello, this is Khurram Nasir, and you're watching Optometry with Khurram. And we have discussed in our previous playlist about the soft contact lenses. Like we have discussed about the soft spherical contact lenses, and we have discussed about the soft toric contact lenses in details. And in this video, we are going to start another important type of the contact lens, which is called the RGP lenses, the rigid gas permeable contact lenses. Right? Previously, people used the hard lenses, right? The hard lenses means the material which is used in the hard lenses was the polymethyl methacrylate, right? PMMA, and that material was very hard and very hard to handle as well, and that material was not even flexible, right? And the very bad thing about the hard lenses was the dk over t value was almost zero, right? So what is dk over t value? Dk over t value, the d means the diffusion, the process of diffusion, right? If the, for example, the oxygen is penetrating or diffused through the surface of the lens and it is moving towards the cornea, right? So that is called diffusion, right? And k was the coefficient or the the constant, and the t was the thickness of the lens, right? So this is called the dk over t value. And in the easiest way, what is dk over t value? It means the ability of the lens, the credibility of the lens, the property of the lens to penetrate the oxygen or the water through the surface of the lens towards the cornea. So this dk over t value is very important for the health of the cornea. So the dk over t value, this ability, this credibility, this property of the lens in hard lens was zero, was nothing, right? So these hard lenses are therefore obsolete right now, and these hard lenses replaced by very important type of the lens, which are the RGP lenses. What does it mean? What does it mean when we say the RGP lenses? RGP lenses is mean R mean rigid, but gas permeable, right? What does it mean? It means that uh, they are rigid, they are hard, right? So they retain their original shape, but unlike the soft contact lenses, they do not drap over the surface of the cornea, right? So they are rigid, right? And gas permeable means the dk over t value is comparatively very good as compared to the hard lenses, right? So the oxygen or the water can penetrate through the surface of this lens. Mostly the oxygen can penetrate through the surface of the lens, and it can create good signs for the health of the cornea, right? So this is called the RGP lenses. And if we use hard lenses or the lens which do not have any dk over t value, the good dk over t value, right? It can cause corneal hypoxia, it can cause corneal edema, it can cause neovascularization. So these type of disorders of the cornea can come when we use the lens which is having the low, dk over t value, or having no any dk over t value. And now we will discuss about the indication, the clinical indications of the RGP lenses, to whom we have to prescribe the RGP lenses, the rigid gas permeable lenses, right? And we can prescribe RGP lenses to the keratoconus, right? Pellucid marginal degenerations and post LASIK, surgery complications, and in high corneal astigmatism and in high myopia in orthokeratology, right? So in these specific and particular conditions, we can prescribe the RGP lenses. And now let's discuss about the parameters of the RGP lenses, which is very important. Like the parameters is like the identity card, right? For the assessment of the contact lens or for dispensing of the RGP contact lenses, right? And there are different parameters, important parameters, right? Which are very helpful while we are dispensing the RGP lenses. And the first, the parameter which is very important is called the base curve, right? Base curve is actually the radius of curvature of the posterior and central surface of the contact lens, right? So this is called the base curve of the RGP lenses, right? So there are, I will segregate the base curve of the cornea, the base curve of the RGP lens into two different categories, right? The first one is called the initial base curve, and the second one is called the final base curve, right? So we have to select the base curve of the lens of the RGP lens. So what is actually the initial base curve, and how we can rule out, how we can find the initial base curve of the contact lens? And this is the answer is very simple, and that is the keratometry. And the initial base curve will be we can rule out the initial base curve with the help of the keratometry, right? We will have the keratometry of the patient, right? Patient's cornea, and we will get K1 and K2 readings, right? For example, K1, K2 mean one meridian is steeper meridian of the cornea, and the second one is called the flatter meridian of the cornea, right? So we will get our flatter meridian as our base curve of the contact lens. For example, K1 is 7.5 millimeter and K2 is 8.00 millimeter. So you know very well that 8.00 is more flatter than the 7.5. So 8.00 will be my patient's base curve, initial base curve, right? And after that, I will refine my initial base curve to the final base curve, right? And how? With the help of the fluorescent pattern, right? We will instill the fluorescent in the presence of the hard contact lens, with the presence of the RGP lens, and we will observe the different parameters, the different observations inside the eyeball, like the chemistry between the cornea and the RGP lens. For example, we can have the steep fitting, we can have the flatter fitting, and we can have the optimal fitting as well, like the apical clearance and the apical bearing and the alignment fit, right? We will discuss these terminologies like the apical clearance and the apical bearing in the upcoming videos, right? Stay tuned. So this is how we can find the base curve, right? The initial base curve with the help of the keratometry, and final base curve with the help of the fluorescent pattern. So this is the base curve, and now the next very important parameter is called the TD, the total diameter of the RGP lenses. And how we can find that? We can easily find that the total diameter with the help of the HVID, the horizontal visible iris diameter, with the help of the corneal curvature, right? And with the help of the practitioner preference or the patient's need, right? We can help with these, with these parameters, we can find the total diameter of the RGP lenses, right? And the calculation is, for example, we assume that HVID of a patient's cornea is, we assume 12 millimeter. So we will subtract 2 millimeter or 2.5 millimeter, depends on the practitioner, preference. We can subtract this 2 millimeter or 2.5 millimeter from the HVID, and the resultant will be my patient's total diameter, TD. So you know that the RGP lenses are very smaller in size as compared to the soft lenses or the scleral contact lenses, right? Because the RGP lenses have to fix at the central portion of the cornea, not at the scleral portion or not at the peripheral cornea, right? So it will treat the irregularities of the cornea. So the RGP lens is treating, what is the difference between soft lens and the RGP lens? The soft lens only treat the refractive errors, right? That's it. But RGP lenses will treat two different things, like number one, the refractive errors as well as the corneal irregularities. So RGP lenses indications are different, as we have discussed earlier. So for example, if we have larger cornea, the bigger cornea, we have to select the bigger diameter. Or if we have the smaller, the smaller cornea, we have to select, the steeper. And if the cornea is flatter, then we have to select the bigger diameter. And if the cornea is steeper, then we have to select the smaller, diameter of the contact lens. And the next parameter is called the OZD, the optic zone diameter, right? And what is optic zone diameter? Optic zone diameter, the diameter, right, of the central portion, the central optical portion of the cornea, right? And this optic zone diameter is very important while we are dealing with the RGP lenses, right? It can hurt, it can affect, the fluorescent pattern, and it affect the vision as well. And now another parameter which is called, the edge lift, right? The edge lift is actually the distance between the edge of the contact lens and the cornea. This distance is called the edge lift, right? And for example, if the edge lift is very small, right, is very small, then it can cause, the tight fitting. It can cause the poor tear exchange, right? It can cause a 3 to 9 o'clock staining while we will deal with the fluorescent pattern. And if the edge lift is too big, if the edge lift is too great, right, more than the normal, then it can cause the excessive movement of the contact lens. The contact lens will move over the surface of the cornea, or move to and fro and up and down on the surface of the cornea, right? So the normal value of the edge lift is approximately 0.5 to 0.6 millimeter, right? So this is the normal value of the the edge lift in the RGP lenses. And finally, we will discuss about the power of the contact lens, power of the RGP lens. The power of the RGP lens depends on several factors. Like, for example, what is the the power of the spectacles, right? If patient visits your clinic and is having his or her glasses, spectacles, you have to have that power of the spectacles, number one. And the second one is called, you have to convert this spectacles prescription into contact lens prescription. This is number one, right? This is an important point about the power of the contact lens, power of the RGP lens. And the second one is called the back vertex distance, right? You have to have the back vertex distance if the prescription is very high, like -5 or -6 or +5 or +6, right? So if the prescription is high, you have to have the back vertex distance. And the very important thing about the RGP lens is which the soft contact lens doesn't have, is the called the formation of the tear lens. So when you insert a RGP lens over the surface of the cornea, there are three different lenses. Number one is called the cornea itself, which is a lens, right? And the second lens is called the RGP lenses, which you have inserted inside the patient's cornea on the surface of the cornea. And the third lens is called the tear lens, which is between the cornea and the RGP lens, which is called the tear lens. So tear lens is very important. The formation of tear lens is very important while we are dealing or studying the RGP lenses, right? And this tear lens can affect the visual acuity of the patient. It can enhance or it can reduce the visual acuity of the patient, and it depends. We will discuss in further videos, right? So stay tuned. So, and after that, the very important thing which can affect the power of the RGP lens is called the over refraction, right? So these are some different things. And what is over refraction? Over refraction is actually, for example, if the total prescription of the patient is -6 and you have trial lens of -4, right? So the required power was -6. You inserted a lens which is having -4, and the rest of the 2 power, we can prescribe that power with the help of the over refraction. And we will, so for example, if patient is inserting a lens, right, and you are putting or you are introducing the trial lenses before the patient's eye, so that refraction is called the over refraction. So these are some important factors in power of the RGP lenses. And this is very initial and very first video on the RGP lenses. In the very next video, we will discuss about the different, how to select the base curve of the contact lens of the RGP lenses precisely, right? And after that, how to convert the dioptric power into millimeters, like the base curve, right? And we will discuss about the different patterns of the fluorescent. Like we will discuss about the different terminologies, like what is actually the apical clearance, what is actually the apical bearing, what is on fit or on K alignment of the RGP lenses, and what is edge lift. So stay tuned. We will see you in the next videos.